Hi, and welcome to my presentation. My field of study is healthcare administration and management. I'm going to explain to you in some details. Areas where significant changes are happening in the U.S. healthcare. Three main areas where major changes are happening are disease management and delivery of care. The basic definition of these terms are mentioned. I'm going to mention them below. Doing a comparison of healthcare systems in the U.S. and Europe. The comparison is made between the cost, the disease occurrence, and the service delivery of healthcare. The cost occurred in the U.S. is much higher than occurred in other nations. This has led rise to equability in receiving services by a patient. In case of public insurance, U.S. healthcare has a better scenario. The comparison of healthcare in the U.S. and Europe. Okay, the cost incurred by the U.S. on healthcare is 15% of total GDP. This is a grim situation that even after huge spending by the nations, universal health coverage is yet not achieved in the U.S. Comparison of U.S. healthcare in Canada. Canada's healthcare service provides comprehensive coverage due to its public funded program. Services are more accessible as compared to the U.S. Rate-wise comparison. Did you know in Europe and in Canada, healthcare coverage is better ranked than other categories, which is not in the case of the U.S. This is because of lack of policies. The scenario has changed since the launch of Obamacare, but overall improvement might just take a little bit longer. In Europe, there are limitations when quality of delivery of care is considered. My recommendations. There is a need to make significant changes in policies which address healthcare coverages, delivery of care, and disease management independently. Accountability has to be increased and is required in delivery systems. This has to be done with a feedback system over which improvement made to be analyzed. The process cannot be improved at one go, but needs a step-by-step analysis to ensure robust systems. So these are my recommendations which can help to better our healthcare system. Also, my recommendations is when these major steps are taken for every individual residing in America, these steps can help to improve our healthcare that we have not yet achieved. As time goes on, as we move on to it, I believe that we will see a significant change in our healthcare system. These are the references that I have used in this presentation. I want to thank all of you for watching this presentation, and I hope that it had enlightened any areas that you were confused in. I thank you for watching my video.